is cardiac output and keeping the heart beating. All right. So let's start with cardiac output. That is what stuff the cardiac, the heart, puts out. That makes sense. Which is blood, which you already knew, but we're going to quantify it. So cardiac output, first we'll define it. Output is defined as the volume of blood pumped out of the heart each minute. Volume of blood pumped out of the heart each minute. And we can quantify it. We even got a formula. It's probably the only formula in anatomy. Now there's other ones, but meh. For our purpose here. Ready? Cardiac output. Or CO. Not to be confused with carbon monoxide. Not good for you, by the way. Equals...
Something times something.
Yeah, something times something. Right.
I remember it from last night, but I can't remember.
Heart rate times stroke volume. HR times SV. Heart rate's easy to calculate. Basically, you just got to feel for a pulse. And one of the better places is right here. Okay, here's your wrist. You got a couple major arteries going through here. Both of them named after bones. The one we're going to feel for is on this side by your thumb. What artery is that?
This way.
The radial artery. So if you take two fingers and put them in this little dent right here, you should feel a pulse. Less you're dead. No. Yes, question.
They can never find my pulse in my wrist, even like when I go to the doctor.
Oh.
They can only find it in my
Okay. Well, if you can't find it in your wrist, you can certainly get the one up here, the carotid artery, which will be right about here on the side of your neck. Feel those thumps. Okay. Everybody gets you when you get your thumps. Let me know. All right. And I'll tell you when to start counting. Are you ready? And go. Stop. All right, take that number and multiply by 4. Now, if you're really actually doing your pulse rate, because we took 15 seconds there, so multiply by 4. If you're really actually doing your pulse rate for like a heart rate for medical purposes, you're supposed to do it for the whole minute and count for the whole minute rather than taking a fraction of it and multiplying it. But for our purposes here, that should be sufficient. All right, so mine ended up at 76, so I counted 19 multiplied by 4. I measured at 80 in third hour, and then 76 in second hour. So,
Your heart rate's just going down.
yeah, it's just it fluctuates depending on. I guess some of the caffeine in my system is starting to finally getting broken down, so that's good. Here's the average. Average heart rate is about 75 puppies. That would be a terrible unit for this. What would be a good unit for heart rate? Beats per minute. Then stroke volume is going to have to be a volume because its name says volume. Okay? This is going to be 70 milliliters per what? Ejects the ventricles are going to eject 70 milliliters
Per liter of blood?
well, milliliters per liter wouldn't make any sense. We have to have it per something, per beat. So every time the heart beats, it's going to eject that. So the flow of blood out of the heart is not just one constant steady flow. It is a surge. In fact, that's why you feel a pulse. That's what a pulse is. When the ventricle is contracting, it's sending a surge of blood through, which expands out the blood vessels just slightly as they do. Blood vessels are stretchy. If you don't believe me, reach into those hearts back there. I've got some more. We had some fresh from this weekend, so that's good. Maybe I should have phrased that any other way. Okay, here we go. 70 times 75, you multiply those two together, you're going to end up with a number like this. 5250. And I'm going to cancel out what unit? Beats will cancel out. And I'll end up with mils per minute. That's a lot of blood. It really is. Let me see if I can quantify that. I don't know if I have that much blood back here. I want to see if you're paying attention.
I can donate some.
Thank you. Yeah. Yeah. See this? 2.5 of these of blood went through your heart in the last minute.
Is it dangerous to take that much blood out of your body?
Yes, you would certainly die. How big is this guy? This is 3.8 liters. Okay.
That's a gallon.
So yeah, just about this plus this went through your heart while you were just chilling there in the last minute of blood.
So there's more blood pump through your heart, like when you're exercising?
Yes. This times 2 goes through your heart in a minute when you're exercising. Yeah. So if your heart rate is increased, you're certainly pushing that much blood out at a time. It's intense. Okay. So 5.25 liters per minute. And this number varies based on, I realized I was recording this. I just walked away for no reason there. Viewers at home, I was showing this giant vessel plus this vessel, which doesn't help you because we're zoomed in too much, so I apologize. All right.
Also didn't show them their neck.
What's that now?
You didn't show them how to check their pulse in their neck.
That's
either.
true. That's true. So, yeah, my apologize. There we go. My apologize to viewers at home for me no speak English. All right. This number varies based on what? What would influence this? We just said something.
Exercise.
Yeah, exercise.
Being at rest. Stress.
Exercise versus rest. Yeah, these are all good examples. Stress, age, diet,
So, question.
weight.
In younger children, are their heartbeats faster or slower than, say, someone about our age?
In really young children, like in a fetus,
5.
way higher. In a child, slightly higher. And then it kind of levels out from there. I'd have to look
Why are
find out
the
what.
heartbeats faster?
Why does it beat faster if their bodies are so small?
Their bodies are so small. That's a good question.
Like, I feel like it wouldn't need to beat as much since they have such tiny bodies.
Wouldn't they also have a tiny heart, though? Let's find out what the average heart rate of a child.
I just found
Okay. Children 3 to 4, between 80 and 120 beats per minute. Children 5 to 6, 75 to 115. 7 to 9, 70 to 110. Children 10 years and older, and adults. Children 10 years or older, and adults. Also, like big kids, between 60 and 100 beats per minute. Anyway. How about a fetus? Let's find out what that number is.
Would it be
B
faster
times-
when the baby's developing in the womb?
Okay, yes. Normal fetal heart rate is between 120 and 160 beats per minute, so it is higher in little bitty babies. Okay. All right. So words. Question. What keeps the heart beating? And this is the last question I'm going to ask and answer with our notes today. What keeps the heart beating?
Electrical pulses, like what moves the rest of our muscles in the body?
Mm-hmm. That is part of it. Now, I will say both of these things are kind of necessary, because if you take either one of these away, the heart will stop.
Like the brain. Okay, you be brain dead and your heart still beat.
It's true. The brain will influence, like, either increase or decrease the rate the heart beats. The heart can beat on its own as long as these two things are intact. First one is this: the coronary arteries.
That's the reason you had to have bypass surgery.
Yes. Are vessels on the outside surface of the heart that supplies the heart muscle with oxygen and nutrients. That's super important. These guys are the ones that basically keep your heart beating. They're the first branches off of the aorta, and if you look here, here's a good example. In this model, you see here's the aorta. Here's the first branch coming off of it is one of the coronary arteries, the right coronary artery. And it travels down and has all of these vessels that come off of it, and that perfuses the heart muscle tissue itself. The trouble is this: over time, plaque and cholesterol and junk can build up on the inside of this vessel right here, and instead of being nice and wide open, it starts to get smaller and smaller as stuff builds up on the side, and blood has less path to travel through. Sometimes people have, 10% blockages of this, sometimes up to 99 or 100% blockages of these vessels. And in those cases, like Alex mentioned, you have a bypass surgery. And in bypass surgery, what happens is this: they'll cut in to a part of this vessel, and they'll bypass around it like you would detour a road, but they'll take a vessel, a vein from either your arm or your leg, and stitch it to the outside here, so the blood will bypass a section of this vessel to be able to go to the places that it needs to go without being blocked. Question?
Is that the artery that supplies the actual heart itself?
Yes, that's correct. It's the heart muscle itself. This is the blood supply back to the heart. But notice that it's the first pipeline off of here. Here is a tube of oxygenated blood that's going to the entire body, but the first pipeline off of that tube is to make sure the heart has what it needs to go. So if this thing gets blocked up, or any portion of these, and there's another one here, here's the left coronary artery, and if they get blocked up, then they cause a heart attack. That's what a heart attack is. So blockage of these vessels causes a heart attack. Any nursing students know what the real name for a heart attack is? It is called a because myomai means muscle. Cardial, because cardia means what? Heart. Heart muscle. And the word is infarction. I don't know. I like that word. I think it's funny. Sounds like fart. Myocardial infarction. Yes.
What causes a stroke?
Same thing, but in the brain. You have a blockage of blood flow. Now, let me go back to this. Typically, a heart attack is an event. It is one thing, whereas what I described was kind of a gradual buildup of plaque and stuff on the inside of the vessels. Typically what happens is a small clot or thrombus forms and breaks loose or gets wedged in one of those really tiny openings, and that's what causes the event. In the brain, same thing happens. Plaque can build up on the inside of blood vessels, and then if a clot goes, it can block blood flow to a portion of the brain, and it's the same type thing. It's an ischemic event. All right.
Is that the only thing that causes heart attacks?
Yeah. Now they're treated by bypass surgery, which is what I just described, where they will cut a vessel, and it's really invasive. They have to cut the sternum in half, use a chest spreader to hold it open, cut through the pericardial sac, usually lower the temperature. There's a lot of things that has to happen. Sometimes a heart-lung bypass machine, it's really intense.
Don't they try to do a stent before they give you bypass surgery?
Yes, and the other option is a stent.
Because my papa had a couple that was done because he had heart problems since he was little, and they didn't do bypass. They put a lot of stents in him.
And stents do a good job. They're much less invasive. What they do is they're like this spring, more or less, that's kind of pre-loaded to expand out like that. So basically they can go into a vessel, because vessels are really stretchy, that's almost completely closed, and if they can go through a blood vessel in the leg or the arm, bring it back up to the heart and go into one of these coronary vessels that's kind of almost completely closed off, stick this spring in there, and it expands out and it'll stretch the vessel out so blood can flow through there more effectively. People that get these feel better immediately. Like, my grandpa was near death's door. He had like no energy. We pretty much thought he was going to die like any day. He went, the doctor's like, yeah, we need to put a stent in. Like, he was a different person walking out of the hospital, like having the energy to carry on conversations and feeling good because his heart had blood flow again. And so this makes a big difference if they can do it. And sometimes this won't be sufficient to do the job. The other thing that keeps the heart beating has nothing to do with blood at all, and it is the intrinsic conduction system. This system is the electrical, basically the nerves and nerve bundles. And when you hear the word nerve, I want you to think living wire. That's what a nerve is. It's a cell that is a biological electrical wire, okay? That generate the electricity that makes the heartbeat. Remember, for the cranberries to be released, what has to hit the castle? Lightning has to strike the castle. This is the lightning that strikes the castle of the heart. Okay?
Okay. Offset just a little bit. Why do they have put pacemakers on? Like, if you've had so many heart attacks, because he had one of those too. Because this system becomes weak sometimes, and it needs a little bit of extra electrical stimulation to help it do its job. That's what a pacemaker does. We all have a pacemaker, a natural pacemaker of the heart that's part of this intrinsic conduction system, which we'll talk about in our next lecture. But sometimes it needs a little bit of extra help, and that's what that's all about.